Hi, my name is Chris Fulkins. I'm a research scientist at the New Brunswick Institute for Research, Data and Training. And today I'm going to talk about work that we've done recently looking at the impacts of the COVID-19 pandemic on mental health and substance use in New Brunswick. So this work was supported by funding from Mitacs and the New Brunswick Health Research Foundation, as well as the Maritime Sports Support Unit, and was also supported by funds to Statistics Canada and the organizations that support them. This work was conducted this past summer by a group of summer students under my supervision as part of NBRDT's Pathways to Professions Summer Experiential Education Program for undergraduate students. This program gives students a chance to work with NBRDT researchers to conduct an original research project. So this was my research team from the past summer. And I also want to acknowledge the contribution of Chandi Somayaji, senior data analyst at NBRDT. She led the students in the lab through the data analysis work on this project. So just to provide a bit of background on how this project came about, we heard about this in the introduction as well. The mental health effects of the pandemic have been a very commonly studied topic over the past few years. Several studies have demonstrated negative mental health outcomes and increased substance use associated with the pandemic. There's been studies in Canada as well as internationally. There hasn't been a lot of this type of research focused in New Brunswick, although there has been at least one study that we know of, and I'll just briefly summarize that now. So this work was done by Dr. Sandra Magalhaes, another researcher at NBRDT, and she analyzed survey results from surveys that were conducted by Mental Health Research Canada during the pandemic. These surveys asked respondents to consider several different factors, so social factors, economic factors, and certain behaviors they engage in, and to rate how these positively or negatively affected their mental health during the pandemic. There were also questions about changes in substance use and household conflict. So Dr. Magalhaes' work analyzed these results, broke them down into population subgroups. And the outcome of this is that it helped us to understand more about the various factors that impact self-perceived mental health and which factors have the greatest impact, and also which population subgroups are most affected. And there was also evidence from these surveys of increased alcohol and cannabis use and increased household conflict during the pandemic. So if you're interested in this study, I've provided the link to the report here on our website. You can read more about it there. I encourage you to do so. So if we think about why these kinds of studies are important, there are several reasons why these types of results may be of interest. So on the most basic level, they can help us understand in detail the consequences of the pandemic in terms of mental health. They can help us understand who is most significantly impacted, both in terms of demographic characteristics, as well as in terms of geography. So maybe which regions are most affected. And this kind of information can be useful in guiding policy decisions. So, for example, if we think about pandemic recovery, we may be interested in developing targeted interventions to support mental health. This kind of research can help us decide where to put our resources so they're used most effectively. This can also be relevant in terms of preparing to face similar challenges that might come in the future. So that could be another pandemic, for example, hopefully not. But other major challenges at the population as well. This type of research can be relevant there. And then just thinking more generally about healthcare and health system management. Research like this can help us to understand areas of vulnerability in our population when it comes to mental health. And lastly, I'll just highlight the importance of having New Brunswick specific data. So we're talking about identifying challenges and vulnerabilities at the population level. It's likely most accurate to do so by studying our own population, because our population is not exactly the same as other populations. So there's some value there in having work like this done in New Brunswick using New Brunswick data. So this brings us to the study I want to tell you about today. So there were 3 research objectives for this study. I'll talk about the first 2 now, and then the third one will be addressed later in the presentation. So the main research objective here is to look at changes in mental health and substance use associated with the pandemic in New Brunswick. And we're doing this by comparing survey data from 2 different time points. So from surveys taken before the pandemic compared to surveys taken during the pandemic. And the second research objective is then to identify personal characteristics associated with negative mental health changes and increased substance use during the pandemic. So this is about understanding who's most significantly affected. So just to highlight what's different about our work, if you compare it to the other sort of New Brunswick study I just reviewed. So we're also using surveys here, but they're different surveys. So the sample population is different questions are asked. It allows us to address some different things in different ways. And the second key point is there's an important difference in approach here. So we're using what I alluded to as this 2 time point approach. So I'll get into a little bit more about that on the next slide here. So we're using 2 different surveys. So the first is the Canadian Community Health Survey, CCHS. This is a Statistics Canada survey. It's conducted every year. It has questions about health in general. It also touches on mental health as well as substance use. And since this is done every year, it can provide us information from before the pandemic. So it gives us a sort of a baseline understanding of what was happening in the population before the pandemic. The other survey we're using is the Survey on COVID-19 and Mental Health, the SCMH. This was, again, Statistics Canada survey conducted during the pandemic. And this one was geared a little more specifically towards the pandemic. However, it was expressly designed to contain questions that were identical to many of the questions in the CCHS as well. And this was done purposely so this type of comparison could be done. So we have answers to the same question from both time points that can allow us to characterize change. And so if we think about what an advantage might be of this 2 time point approach, it allows us to directly measure something we're interested in at 2 different time points and compare those. So if we're interested in depression, for example, you'll see in the coming slides, we're using a series of questions, like a validated screening tool that allows us to determine whether we think someone's likely to be depressed. And we can do that before the pandemic and during the pandemic, and then compare those and get an idea of how things have changed. Now, if we contrast that to an approach where we're just using a single survey taken during the pandemic, then we have to frame the questions like you see here, like, do you feel worse now compared to before the pandemic? And now we're relying on someone's ability to remember and to rate themselves before and now, and we're relying on sort of their own opinion of the matter. And you can see there's maybe some potential for bias here or lack of recall. And so we can mitigate that a little bit by using this 2 time point approach. So that's really the strength of this 2 time point approach that we're using. There have been previous studies that have used this approach as well, so I don't want to make it seem like we've invented this. Here's a couple of examples here. They've used this same 2 time point approach to study the effects of the pandemic. So we've adapted our methodology from these published works. And so just to review then, the approach that we're using. So we're looking at Statistics Canada surveys, looking at results from before the pandemic, during the pandemic, and comparing those to see how mental health and substance use changes. And our study population for this work is New Brunswick residents aged 19 and older, so adults living in New Brunswick. So there are 5 outcomes that we looked at here. So we're looking at the prevalence of depression and anxiety at both time points, as well as the prevalence of low self-rated mental health, habitual binge drinking, and habitual cannabis use. And I'll get into more detail about how we define these in the coming slides. In terms of results, what we're going to be looking at is first the raw prevalence difference, so the prevalence before the pandemic, and comparing that to the prevalence of each of these outcomes during the pandemic. We're also going to be looking at regression results. So we used logistic regression to model the likelihood of each of these outcomes during the pandemic relative to before. Our models control for various covariates. I've listed those here in the blue box. So we have age and sex, where you live in terms of health zone, as well as whether it's rural or urban, whether you live alone or with others, your income quintile, and education level. So those are all controlled for in the models. So the first outcome we looked at was depression. We're doing this so we're looking at questions from the surveys. It's a series of 9 questions that together form what's called the PHQ-9, which is a validated screening tool for depression. The questions are, there's an example of one here. So they all take this form. Over the past 2 weeks, how often have you, so this one is how often have you had little interest or pleasure in doing things? Based on the response that's given, we would score the response from 0 to 3. And then we add up the score given by all 9 responses, and we get a total score. And then based on the table you see here on the right, we can rate the severity of someone's depression. And for our purposes, for this study, we're saying that anybody with a score of 10 or higher, we're going to consider that they're likely to have depression. So here are the results in terms of raw prevalence. So before the pandemic, about 6% of respondents met the criteria for depression. During the pandemic, that's increased to about 20%. So quite a substantial increase here, 14 percentage points. This is equivalent to over a 3-fold increase in the prevalence of depression. And just looking at our confidence interval here, the confidence interval of the difference is not crossing 0. So this tells us we're pretty confident that this is a real difference. So we say this is a statistically significant. Here now we're looking at our regression results for the same thing. So for depression during the pandemic compared to before. The number you see here, 2.3, this is an odds ratio. So you can read this as the likelihood of depression during the pandemic relative to before. So we can say there's a 2.3-fold higher likelihood of depression during the pandemic compared to before. The blue vertical line you see here centered on 1. This corresponds to an odds ratio of 1. An odds ratio of 1 would mean that the likelihood during versus before the pandemic is the same, so no change. So what we want to see here is our error bars surrounding the red point. That's our 95% confidence interval. So that's where the range in which we're confident that our true value lies. So the 2.3 is sort of our point estimate, and the confidence intervals are range surrounding that. So as long as those error bars are not crossing that 1 line, we can be pretty confident that this is a real result and it's statistically significant. So we see this is a 2-fold difference here, statistically significant for depression. So now thinking about our second research objective, we're looking at identifying personal characteristics associated with that increased prevalence of depression during the pandemic. And the characteristics we're looking at are all those covariates I talked about that are included in our models. So the way we do this is we consider, say, one of the covariates we're interested in. So in this case, using age as an example, we divide that into categories. So we'd have a younger age group compared to an older age group. And we'd look at the likelihood of depression in young versus old at each time point, so before the pandemic and during the pandemic, and we generated an odds ratio of each, so the odds ratio for young versus old for depression at both time points. And then we'd compare those, and based on the difference between them, how they look, we can get an idea of which of these age categories is more sharply affected in terms of increased depression during the pandemic. So I'll just give an example here so you can see how that works. This is real data, so this is data from the study. So we're comparing our younger age group, age 19 to 39, versus a 65 plus age group. So before the pandemic, the younger age group is 3.3 times more likely to be depressed than the older age group. During the pandemic, the younger age group is still more likely to be depressed, but the difference is less. So they've gone from 3.3 times more likely to 2.7 times more likely to be more depressed than the older group. So if you think about it, the difference between these two groups has declined, so they've become closer together. That can happen essentially in 2 ways. Either the younger group becomes less depressed or the older group becomes more depressed. And we know from our results that no one is becoming less depressed. So that tells us that the older group is in fact becoming more depressed relative to the younger group. So what this tells us is that older age group is more sharply affected by that increased likelihood of depression during the pandemic. So using this approach, we can look at all of the covariates in our model and determine which of those factors are associated with increased prevalence of depression. So depression increasing during the pandemic. And so I've bolded those here on the left-hand column, so you can see older age, higher income, living in Fredericton versus Moncton, which was the comparator, living in an urban area and living alone. All of those characteristics are associated with increased likelihood of depression during the pandemic. So the next outcome we looked at was anxiety. This is measured in a very similar way to how we did depression, again, using a validated screening tool. This one's called the GAD-7, so it's a series of 7 questions related to anxiety, and they take the form of the question you see here. So for example, over the past 2 weeks, how often have you been able to stop or control your worrying? And again, the response is graded on a scale of 0 to 3. We add those scores together to get a total. And here, again, we're considering anybody with a score of 10 or higher to be likely to be suffering from anxiety. So now looking at our raw prevalence again, so about 14% of people are meeting the definition of anxiety before the pandemic, and that goes up to about 17% during the pandemic. It's a difference of about 3 percentage points. We see here, though, that our confidence interval for the difference is crossing 0. So that means there's a reasonable chance that the difference is actually 0. So we can't say that this is a significant difference. This is not a significant change in anxiety during the pandemic. And our regression results show basically the same thing. So in our adjusted model, the odds ratio, the point estimate suggests that there is maybe an increase, but the confidence interval is crossing that 1 line. So that's telling us there's also a reasonable chance that there's just no difference here. So again, regression results reflecting no significant change in anxiety during the pandemic. Next, we looked at low self-rated mental health. So this question in the survey is asking the respondents to rate their own mental health. So in general, how is your mental health? That's the question. If you responded fair or poor, we're going to consider that to be low self-rated mental health. And what we're looking at is the prevalence of people who responded fair or poor. So before the pandemic, about 10% of people had rated their mental health as low. During the pandemic, it was about 19%. So it went up about twofold, 9 percentage point increase. So a fairly substantial increase. And again, this is a statistically significant result. And looking at our adjusted models, the odds ratio, it's a little different. This because we're adjusting for all our covariates here. So it's where we saw a twofold difference in the raw prevalence. This is about a 1.5-fold difference, but it is statistically significant. So we're reasonably confident that there is an increase in the prevalence of low self-rated mental health when we look at the pandemic time point. And again, using the same approach we talked about earlier to identify characteristics associated with that increase in prevalence of low self-rated mental health. We have younger age, living in Fredericton and living in an urban area. So again, we saw a similar pattern with the depression results. Additionally, here we have higher education and habitual cannabis use. Those are also both factors associated with increased likelihood of rating your mental health as low during the pandemic. And the next outcome we looked at was habitual binge drinking. So binge drinking is defined as 4 drinks for women or 5 drinks for men on one occasion. And the question is framed as during the past 30 days, how often has that happened? So how often have you had a binge drinking session? And we've said that if you're doing that once a week or more, we're going to count that as habitual binge drinking. So about 8% of people were habitual binge drinkers before the pandemic. That increased to just over 13% during the pandemic. So it's a 5 percentage point increase, about a 70% increase. And that is significant. And then looking at our adjusted models, our odds ratio, it's an odds ratio of 2, so about a 2-fold increase reflected in the adjusted models. And again, this is significant. So we're pretty confident that binge drinking has increased during the pandemic. Factors associated with increased habitual binge drinking. So we have younger age as well as older age, actually. So the way this shakes out is we have 3 age categories, so 19 to 39, 40 to 64, and 65 plus. The association between binge drinking and age is strongest with the younger group, and then next strongest with the older group, and then that middle age group would have the weakest association with binge drinking. Also female sex and higher education, both associated with increased likelihood of binge drinking during the pandemic. And the final outcome we looked at was habitual cannabis use. So it's framed similarly to the binge drinking question. So in the past 30 days, how often did you use cannabis? If you're using cannabis once a week or more, we're calling that habitual cannabis use. And there were about 9% of respondents were habitual cannabis users before the pandemic, and that increased to 12% during the pandemic. A smaller increase here, about 3 percentage points, 40% increase. This was statistically significant, however, so reasonably confident there is an increase here. And again, in our adjusted models, also a statistically significant result, so about a 70% increase here showing in the adjusted models. And looking at personal characteristics here associated with this increase, there was only one that came out, and it was in the older age group, showing an association with increased cannabis use during the pandemic. Okay, so that was our first 2 research objectives. So now I'll move on to our third research objective. And this was to identify pandemic-related experiences associated with adverse mental health outcomes and increased substance use during the pandemic. So just sort of looking at things in a different way, we've established that there are negative mental health changes during the pandemic. There are increases in substance use. And we've looked at some personal characteristics. Now we're going to look at things that people experienced during the pandemic and how those associate with these changes we've observed. So we're doing this again using survey results. Here, however, we're down to using only a single survey. We're using the SCMH survey, which is the survey that was conducted during the pandemic. And the reason we're using a single survey here is because the questions that get at these pandemic-related experiences were, of course, only asked during the pandemic. So we don't have the ability to use this before and after approach. We have to just use the pandemic time point survey. So we're using regressions again here. The outcomes we looked at, which become the dependent variables in our regressions, are basically the same 5 outcomes we just talked about. So depression, anxiety, worse self-rated mental health, increased alcohol consumption during the pandemic, and increased cannabis use during the pandemic. And then the pandemic related experiences we looked at. So then again, we're getting at these through questions that were asked in the survey. So did you experience feelings of loneliness or isolation due to the pandemic, for example? Yes or no? That's how we're getting at each of these experiences. These become independent variables in our models. So the list of these we looked at were feelings of loneliness and isolation due to the pandemic, emotional distress due to the pandemic, challenges in relationships due to the pandemic, physical health problems due to the pandemic, difficulty meeting financial obligations, or losing your job or losing income due to the pandemic. And just continuing that list, increased alcohol or cannabis use during the pandemic, and increased alcohol use specifically due to stress or loneliness during the pandemic. These ones that are substance related, we're looking at those in relation to our mental health outcomes, not of course in relation to our substance use outcomes, because they're the same thing. So these lists of experiences were included as independent variables in the models, but they weren't the only ones. So we again adjusted for several personal characteristics in the models as well. And those are listed here. So many of the same ones we adjusted for in the first 2 objectives that we saw. So age and sex and where you live, income and education level, household composition, a few additional ones here as well. So whether you've experienced household violence during the pandemic, whether you personally were diagnosed with COVID or you had friends or family that passed away due to COVID, whether you were a frontline or essential worker during the pandemic, frequency and amount of alcohol and cannabis consumption, and various self-care behaviors that you may have engaged in to support your mental and physical health during the pandemic. So these are all included in the models. The models are adjusting for these. So what we end up with when we look at each outcome is an odds ratio for each of those pandemic-related experiences associated with the outcome. So here we're looking at depression. This is again using the PHQ-9 scale for depression. And again, this is just looking at depression during the pandemic time point. So it's were you depressed during the pandemic, not looking compared to before the pandemic, but just were you depressed during the pandemic? And the odds ratios here, what they represent. So if we look at the top one here, it's about 2.2. This is the odds of someone who said they did experience loneliness and isolation due to the pandemic. It's their odds of being depressed compared to the likelihood of being depressed for someone who answered that they did not experience loneliness and isolation due to the pandemic. So the way we would read this is that someone who did experience loneliness and isolation due to the pandemic is about 2.2 times more likely to be depressed during the pandemic than someone who did not have that experience. So using the sort of same approach we talked about earlier, looking at our error bars and looking for the ones that are not crossing that blue line, we can see the experiences that are significantly associated with our outcome. And those are bolded here on the left-hand side. So loneliness and isolation, emotional distress, physical health problems due to the pandemic, difficulty meeting essential needs due to the pandemic, and increased alcohol consumption due to stress or loneliness. All of these experiences are significantly associated with being depressed during the pandemic. Okay, so next here, structured in the same manner, we're looking at anxiety. So again, just were you suffering from anxiety during the pandemic, not looking back to before the pandemic. And so again, determining which of these are significant in the same manner. They're bolded again on the side here. And we see that the list is actually exactly the same as the ones we saw in depression. If you compare them here, so it's the same set that are bolded, plus there's one additional one for anxiety, and that is loss of job or income. So if you lost your job or lost income due to the pandemic, you're about 1.6 times more likely to report having anxiety during the pandemic. Next, worse self-rated mental health. So this one, the way the question is structured, does build in a component of looking back to before the pandemic. The question being asked here in the survey is, compared to before the pandemic, would you rate your mental health now during the pandemic as worse? So we're looking at people who answered yes to that, and how that answer of yes associates with each of our experiences. And again, identifying which of the experiences are significantly associated. We again have loneliness and isolation, emotional distress, and physical health problems, just like we had with depression and anxiety. But then 2 additional ones come out here that did not come out in the previous 2, increased alcohol consumption and increased cannabis use during the pandemic. Both of those are associated with someone saying that their mental health is now worse during the pandemic than it was beforehand. Okay, now we're shifting to look at the substance use outcomes. So we're looking at increased alcohol consumption now. So the question here in the survey is, compared to before the pandemic, are you drinking more now during the pandemic? So again, this is building in that look back element, so comparison to before the pandemic. And we can see two experiences here. So experiencing emotional distress due to the pandemic or relationship problems due to the pandemic. Both of these are associated with drinking more during the pandemic than before the pandemic. And then finally, when we look at cannabis use, so again, the question here is, compared to before the pandemic, are you using cannabis more often now during the pandemic? And we see actually the same two experiences. So people who experienced emotional distress or relationship problems due to the pandemic are more likely to say that they have increased their cannabis use since before the pandemic. So that brings us to the end of our results, and I know it was a lot to take in all at once, so I just want to try to summarize them briefly in these last couple of slides. So we found that 4 of our outcomes increased in prevalence during the pandemic, and so depression, low self-rated mental health, habitual binge drinking, and habitual cannabis use. There was an increased likelihood of all 4 of these during the pandemic based on the survey results. And we identified a number of personal characteristics that were associated with, so these groups more likely to experience that increase in likelihood. So those are summarized here on the right-hand side. And then just looking at that latter part of the presentation, our third outcome, or third research objective rather. So these are our pandemic-related experiences that we identified being associated with adverse mental health outcomes. So depression, anxiety, and worsened self-rated mental health. And you can see just the pattern in red here showing which experiences are associated. So quite a bit of overlap between depression and anxiety. Self-rated mental health looks a little bit different, and we see that that substance use component really coming to the forefront here on the bottom right-hand side, the 2 red boxes there. And then finally, just looking at pandemic-related experiences associated with increased use of alcohol and cannabis during the pandemic, and we saw that consistency across both of those. So emotional distress and relationship problems due to the pandemic, those seem to be important in terms of being related to increased substance use during the pandemic. So I'll end there. So thanks very much, everybody, for joining us today. If you're interested in learning more about this work or in working with administrative data, please don't hesitate to reach out or to visit us on our website, and we'd be happy to chat. So thanks very much.
Thank you.